Hello, friends. A very good day to all of you out there, and a very, very warm welcome from the entire team of RFA tutors. Thank you so much for joining in. Your mentor this side. I do understand the anxiety and stress that you all have been having after the recent announcement. I would like to reassure that college definitely has taken this decision in betterment and, of course, keeping safety into the consideration. A very warm welcome to all of you with lots of questions in your mind. I thought it's better to meet you guys, to address all the concerns, to listen to you guys, to give you reassurance that since the COVID times, we have been seeing the ostlers, we have been seeing the online exam. We just need to understand that how it would be. There are definitely disadvantages and advantages both, but we just need to learn how to make it the best preparation for us and how to make it the best appearing an exam and make it a success together. How's everybody doing out there? Thank you very much, Dina. How are you doing today? Hi, Raisa. Walaikum assalam. And thank you very much for lovely flowers out there. Hi, Felix. How are you, my dearest? How's everyone? Give me a thumbs up. Give me that energetic emojis that you all are ready to know about the Osler. Yasmin, so good to see you, my dearest. Thank you very much. Where's Fadi? Hi, Komal. Thank you very much. Good to see you, sweetie. Sajira, thank you very much for joining in. Lots of prayers for you guys. Thank you very much, Reena. Warm welcome, Nada. I'm super proud of the efforts that you guys have been making. And I'm so proud of you guys, the way you have been facing instead of getting discouraged. You still are enthusiastic that you're going to make it. And I'm so happy that whatever is the situation, you guys are putting in your efforts, and that's what's needed. Thank you very much, Sadia Yahya, for lovely hearts. Suresh, miss you so much. Hi, A. How are you doing today? Thank you very much for joining in. Warm welcome once again. What is the agenda of meeting today? Wanted to talk to you guys. Z, that was needed. Asia, that was needed. So thought that I'll just talk to you guys about what's needed in this exam. I can tell you guys that after this session, you guys would be so clear about how the online exam is, Aisha, and you would be having a very clear idea that what is needed, what preparation is needed, what are those simple things which we need to take care of to be successful in the OSLA. Of course, the preparation has to be apt like an exam. But at the very same time, we need to have certain preparations done. We need to know and understand the system. Many students of mine, many mentees of mine have been taking it back in 2020, 21, and every year when we have, especially for the Myanmar students and those who are taking OSLA, we have been. So I have tried to illustrate a very typical screen for you guys through applications, through drawing. So I am sorry once again if the drawings are going to be very animated and cartoonish, but what I've tried to show to you guys is what exactly you will be facing as closer to the reality. And this is just a sketch which I've tried to do for you guys so that you exactly know what would be the expectation. College has got wonderful explanations. College is going to tell you everything prior to that, will make you very confident. You will get your logins, you will get your details. They will take the teaching sessions, and I'm sure that you guys will be very confident before appearing. But I do understand that it's been just 2 days, and I do understand that how much anxiety as a student it brings, knowing that we were planning for face to face. We booked Abu Dhabi because we wanted to be successful. We booked Riyadh because it was easy for us. We were in Riyadh, and it was easy for us to appear in exam there. And similarly, the Lahore students who were there and they're not appearing in Pakistan at the moment. So I do understand the anxiety, but it's absolutely okay. I would just tell you one thing, that we humans, we make plans, but there's somebody out there who makes better plans. So I'm sure what's happening is happening for the betterment. I have very strong faith in this. With this decision, which we have not taken for ourselves, and someone has taken because of the circumstances. When you booked the exam, you didn't know this, right? But some decisions, when they come from high up above, so you need to have faith that this is not my plan, this is his plan. And definitely his plans are always better as compared to we humans. So that is what I need from you guys. Yes, I'm sure Shweta, you agree with this. Aisha Jadoon, this is my faith, and I want this encouragement in you guys that when something happens, that happens for the betterment. And you don't know today when you'll meet me in the success meet, when we will meet in the congratulations meet, and you would say, "Yes, ma'am. See." we decided that day that we will appear with full enthusiasm, and today we are amongst the successful. So with this aim, with this enthusiasm, with this love, let's start the understanding of the OSLA to be in the best of position to appear in this exam, sitting from our home and be successful. All right. So first and the foremost, thank you very much, Nada. I do understand. Absolutely. This is a remote exam, ladies and gentlemen. You're going to be at your home, and we expect a quiet location where nobody should be there, no disturbance should be there. This is a very secure exam platform with live examiners, live video going on, and college is not using it for one day, for 1 month, for 1 week, years and years. And this exam was introduced back in 2020 when we didn't have any exam in a Mrcog Part 3. And first time college did it when the online exam after COVID was there. But you have to be very clear that the pattern is similar, right? When I say the pattern is similar, what do I mean by that? It is the same face-to-face, but virtual. It is going to be online exam. Now, this is the same OSCE style, same 14 stations, and each station is going to be 2 minutes reading and 10 minutes performance time. But 30 seconds are extra here, which is a gap between one station to the other. This is a difference that you guys need to understand. I'll elaborate that just now, which is not in face-to-face exam. As per the college guidance, 30 seconds or more, which is the shifting time from one screen to the other. So instead of 2 minutes, you have 2 minutes and 30 seconds and then 10 minutes performing time, right? Same domains you have: communication with the patient, communication with the colleague, applied clinical knowledge, patient safety, information gathering, same you all have. And each station, you will interact with an examiner. If it's a structured discussion, you will have the layman examiner. If it's a layman examiner station, you will have the clinical examiner, which is the clinical examiner simulated patient task. The scenarios would be on your screen. I will tell you exactly how I've drawn the diagrams and where it would be. And you would see that as per your gadget, you can see the stations throughout your 10 minutes performance as well, right? Now, the most important thing is that you have a structured discussion, you have a simulated patient task, you have a layman examiner simulated with a clinical examiner for stations. The most important thing is that I want a very strong internet connection, specifically in those parts where you do see some sort of an up and down in the connectivity nowadays. I want a very clear internet connection. Please ensure that you are with desktop, laptop, MacBooks. These are important. You are in a quiet room, but well-lit room, and college has very clear guidance regarding that. You should be very clearly visible. And the most important thing which I want that you guys work on from today is a backup plan. When I say backup, please have not 2, 3 internet as a backup. Once in which you're connected, which is the best one, keep your 2 internets at the backup as well. All right, okay. So the most common feedback, which after the previous oscillars, which we had been getting, was there was a little delay, lag in understanding the role play. Ma'am, it wasted my time. My communication was slower. I was speaking, but the info I was getting was very late, or the examiner was not able to understand me. Sometimes because they're on the screen, ma'am, it was a breaking bad news. I was not able to comprehend the non-verbal cues. I couldn't understand that she's maintaining the eye contact or not. It was a depression case. It was a mental health problem, right? Yeah. Time management is very important because you're not physically in front, it is just an online and a virtual screen. So there is a chance that when you're speaking, few seconds delay can cause a little disturbance in your communication. So since examiners can't see everything, they can't see how you're sitting, you're visible till here, they can't see the way your legs are, they can't see how did you enter into the cubicle, they can't see you're sitting in properly, probably your hands are not visible throughout, you're visible the way I'm visible to you till here. So sometimes you need to verbalize a little more, because what they're going to give you the score is like, what is your tone? How is your pitch? How are you speaking? Rather than a complete head to toe understanding. For example, when we take face-to-face the mock exams, we see that the candidate is entering into the cubicle. And when you see they're entering into the cubicle, you see that from the gesture, okay, yes, it's confident. And when you see a certain fumbling attire, you understand. But here, the whole exam is dependent upon your verbal communication, your tone, your speech, your flow, your choice of words, your pitch. All this is very important when it comes to OSLA, rather than your complete get up, your complete walking attire, your complete sitting attire, your complete posture. Do you guys get what I mean? Right? In Osler exam, the most important thing is that you as a toto, what you're speaking is what they're hearing, and that should be so confident that that is the actual marking or the score for you guys. Right? What do I expect now? I always say physical mock exam, and all the students in Abu Dhabi, Riyadh, and Lahore, from their request, of course, we have shifted them to the online exam, the mock exam. I really want that you practice on screen today. I really want that now you start practicing with your buddy on Zoom. I really want that you do Google Meet now. So that whatever you're doing and understanding is that now the practice is the same way as your exam is going to be. A very clear structure in your speech. What do I suggest? For example, it's a surgery. Now the surgery is not going to be hands-on. You're not expected for that, right? So what I want is that you guys really speak. My management is going to be pre-operative, operative, and post-operative care for my patient coming to the pre-operative. There should be such a beautiful structure that you make sections that the person sitting online is so clear about your understanding. Right? Definitely you're going to follow the green top guidelines, the nice guidelines, the TOG article, but you are in a frame. Understand, you have to impress the examiner through that frame. Your camera would be on, you would be having a time practice, and whatever your thoughts are, only your speech, your flow, and your words are going to tell to the examiner that this is how I had been practicing. I do understand that when you were having the face-to-face, you guys were a little more comfortable when we were talking about in the sessions that, I can see the expressions of the examiner, ma'am. I can see that, role player sitting in front of me. So, is she getting comfortable with my talk? And of course, at the back of our mind, the stress is not there, that there can be some technical glitch as well. But when it comes to OSLA, you guys have some sort of a pressure at the back of your head that, oh my God, what if the internet gets disrupted? What if suddenly something happens? I don't know whether I'm audible or not. I am here today to tell you that how you can be satisfied in OSLA, how you guys can have a perfect confidence in OSLA by telling you the advantages and by telling you exactly the checklist which would make you successful if you're appearing in online exam. All right. So what is the advantage, Nada? You guys have a break in Oslo, guys. After 7 stations, you have a 12 minutes break where you can attend the toilet. You can breathe in, breathe out. You can quickly get back to your seat after. You can quickly take some snack. You can have water. So you can have half of the exam and then half of the exam. And this is a real plus point in the online exam, guys, because this was never in face-to-face, right? The second biggest advantage, which is one of the disadvantage of face-to-face, is that in face-to-face, you always have to time yourself. Shweta, we were discussing in the last session, if you remember, the timer throughout is on your screen, which is a very big advantage of OSLA. You can do a perfect ending and winding up when you see, 9 minutes. So, you can give the patient information leaflet, you can connect to the support groups, you can ask about the concerns, you can address the concerns. These two advantages, for me, I always think that they are very big advantages because face-to-face exams in the last 4-5 stations, honestly, you're exhausted because it's a stamina building. It is a stressful time. In Oslo, when you get a break, so after 7 stations, you are quite confident and you're fresh. I mean, like a new part of the exam is starting. Felix, are you there? Everybody, please be interactive in the chat box so that I do understand that whatever I'm saying, we are on one page. Right? Sana? Perfect, my dearest. So, having a break, perfect, my dear Felix. Yeah, that is really good, honestly, Nisha. So after 7 stations, you guys are going to have a 12 minutes break and then you get back to your chair. Again, you log in and 8th station starts, right? Time management is appropriate because here the station is not that you're rushing through it, you're in the middle of the station and it ends up. You're always knowing that, okay, 7 minutes are done, 8 minutes are done, 9 minutes are done. So that's very, very important, this, okay, about this, my dear. Tazeen, I'm going to take all the questions in the end, my love, yeah? So what are the points that you have to keep in mind specifically when it comes to OSLA? As per the OSLA guidance by college, of course, it is 2.5 minutes reading time. 30 seconds are extra. Why? Because they say that technical shifting from one candidate instructions on the screen to the other, of course, it's online, so it takes time. It's not like you are physically moving from one cubicle to the other. Right? So keep in mind that you've got 2.5 minutes reading time. Basically, it's 2 minutes. So 30 seconds are that when it appears, and 10 minutes performing time. Throughout the exam, you've got a chaperone, and that is a real blessing, right? There is going to be a chaperone with you. You have to inform the chaperone if you're leaving, if something is not understandable to you, your role player is not audible, your examiner is not audible, you can't see the screen. Throughout the exam, you're connected to a chaperone, and there's one individual chaperone who is with one individual candidate. Do you guys understand this? Right? How you're going to communicate, how you're going to message, I'll just tell you in a bit and exactly tell you the place where you're going to message the chaperone, and I will tell you what is the best way. The college tells and guides that this is the best way to connect to the chaperone in case of any technical problem. Right? I will do that now. That just now I'll tell you all the questions would be answered, and in the end, I'm going to take if anything is not clear, sweetie. Okay? So tasks are generally made as an online environment. Very clearly, the guidance is given on the emails. The very clearly guidance is given that you are not expected to do any drawing. You know, generally we do that in the exam. I'm going to draw for your understanding, so they know that it's an online setup. How can I explain you that in simple words? You are doing a consultation which is online. Do you guys get it? College expects you to perform in a way that it's an online consultation. So no examination, no prop touching expectation, no holding diagram expectation when it comes to the OSLA exam. Am I clear? Am I clear? Now, the most important thing is your setting. Take care that the lightning is in front of you guys. I always tell students, back in 2020, I was telling the same, that ensure that the lightning is coming in front of you, right? No 2 minutes writing paper. Afreen, this question is coming up. Can I request everyone, please? I know my students. Can I request all of you to please write your questions on a piece of paper, because whatever Afreen, Nada, all of you are asking, they're coming in the upcoming slides. So what I request is please write it on a piece of paper. And if it doesn't get answered in the upcoming slides, we are going to unmute and we are going to take the questions. But these questions, Afreen, they're just coming in the upcoming slides, my love. Okay, then what are you going to do and what are you going to write? Now, I was at the point that lightning is very important. Can you see the person on the left hand side? So this person, is he having a good lightning? No. Whenever the lightning is from the back, remember it is more lit and you would appear dark. Okay, so always the lightning should be from the front. Do you guys understand? Do you guys understand this? Please, if there are some curtains in the back, windows at the back, make sure that you close them. The light should not be coming from your back, because if it comes, then you appear dark and your expressions are everything. That is the most important thing that you guys need to understand, right? So the most important thing, that whatever place you guys want, the college does not say that, remove all the tables or the chairs, but yes, there should not be any reading material because it's an exam, right? Chaperone, every single candidate has a chaperone assigned. and you are being observed anonymous throughout. And if it's you want, you can communicate at all times, either starting from your registration till the end. You can communicate, and they also inform if they see some unusual behavior. They would always communicate, and if there is some smaller tiny issue or if there is some bigger issue, chaperone is there throughout your exam, supervising and seeing if technical glitch is there. What is the best way to communicate? Rather than writing, chaperone is observing you throughout, from your start till your 14th station. Just raise your hand on the screen. You're visible. Even chaperones are visible to you. You are visible. So you raise your hand, they would immediately connect to you that something's wrong. Did you guys understand? Everyone, this is the best way to communicate. You can do message as well. You can have the typing to the chaperone as well. But students always say the faster way. I've not taken Osler, guys. I've taken face-to-face, but many of the coordinators, moderators, mentees, they've taken. So they always say that you raise your hand and immediately they respond, because you are visible to them, and throughout they're seeing you on screen, that if something is wrong, something is disturbing you. Do you guys understand? You're audible to them. Okay, so you simply have to raise your hand if any technical concern is there, so that it is sorted out immediately, please. Same exam ethics as that of face-to-face. You're going to dress yourself professionally, right? Of course, no phones, no reading materials are allowed. Only and only you are allowed to take your notes on the Osla. On the application, I would tell you guys that how you can take your notes. So from today, Raisa, Sana, Nada, Felix, Shweta, everyone out there, you guys will start typing to make your notes. Do you guys understand? You will start typing to make your notes on the Word document to practice that how would you guys do in exam, because there is no pen and you're not going to write that. Do you guys get it? You want to write BMI. You want to write, don't forget the blood group. Don't forget. And I'll tell you that how you're going to do that. It is only visible to you. These are your private notes. Got it? Where would it be visible on screen? I've just drawn it for you guys. Just made it on Canva so that you guys understand. And I'll show it to you just in a bit. Candidates should not be speaking to anyone during exam. I don't want a place for you guys. If you want me to see that, you can definitely send me pictures that, ma'am, this table is okay. Every time students, they just send that, ma'am, this table, this chair is okay. Make your chair very comfortable, please, where you're going to sit. So the table should be definitely of a perfect height where you don't have so much of a back stress. And it should not be a center home of a place of a home. Like, you know, the people are coming and your family members are there. Select a place where you don't get disturbed, right? Rest, it's okay if it's a room, but no reading materials, no phones should be there, and you should not be speaking in between. College does allow keeping water or food in between. You want biscuits, you want quick cookies, or you want something, juice, you can take that in between, but the timer would keep on moving. Only you have 12 minutes break after 7 stations in which you can attend toilet, or you can move from your chair and you can come back. In between, if you are leaving, you have to inform your chaperone. If at all you have to attend a toilet in between, which is unavoidable, you have to tell the chaperone, but your stations would be moving, the timer would be moving, and it will be on the screen. Now, so many of you ask that, ma'am, what if a technical problem happens? What if my role player was not audible? What if the candidate instructions were not visible? What if the examiner couldn't hear me? It was a technical glitch from your side, or it was a technical problem from their side, right? Because of course it's an online exam, so we need to have an idea behind that what would happen. College is already prepared for your best interest in the backup stations. So they do have stations. Either the rerun of the same station would happen or the new station would come. The chaperone is observing. The examiner tells that, yeah, we couldn't hear this station because the timer is going on, right? And the next candidate is going to come to that examiner. So therefore, you guys would have the resit. What happens when the 14 stations are over? You get a signal that your exam is complete, you can log out. If you don't get this sign out signal, that means that you need to keep on sitting there. All right, so then the examiner would come, the chaperone would come, and they would say, station number 3 is a resit for you. Please, at this time, after 30 minutes or 40 minutes, you will have your resit station, because they coordinate with all the examiners who had resit with certain candidates. So you get your time and you stay on the screen by that time. I know students who had 1 resit, had 2 resits, had 3 resit, but there are students who had no resit and the exam went fine. Do you guys get it? So it totally depends upon the internet connectivity, not only yours, of course, the examiners or the role players, or at times it is also because sometimes the instructions were not visible. Is this point clear? So you don't have to worry that if something was not fine to the best of your capabilities, that would be taken, definitely it would be noted down, and college has a very, very fair policy on that. They always support you when something had not been heard or something has not been visible. That's why chaperone is always there. So I know students who used to, have for 3-4 resit because of the technical issues, and they used to complete their exam. They were there, and they had stations to perform later. Okay, so you don't get an exam complete signal on your screen. So if you get an exam complete signal, yes, you can exit and log out. I'll show you the click buttons just now. But if you don't get it, that means that you have some resit. You also realize, because that station, 1 or 2 stations, that's not happening best for you. So you realize that you might have the resit. Okay, clear? Now, a very important point, which many of us, including me, we doctors, we are not very technically sound. And I think I always say that's why we are doctors, right? So because we have some sort of a handicap at certain situations, you need to understand, if your screen is lagging and you need to refresh, please refresh OSLA. What I'm telling you now, you guys would have to know this for exam, not to make this mistake. There are 2 refresh buttons, please. Refresh your OSLA application. Please do not refresh the browser. In your OSLA, you would have these all symbols, right? So this is refreshing the application in the OSLA. If you go on the top on your Google, this is OSLA, and you have the refresh button here. Please do not refresh, because that would make you go out. And again, the registration, the whole process that you had done from the start, you will exit from the application. Because on your screen, you will be in an application, and on the top, you will be on the Google Chrome. Do you guys understand? So many times, students, they refresh when they're asked by the chaperone, please refresh. They refresh Google. All is gone. Do you guys understand the difference between refreshing OSLA and not to refresh your Google Chrome? You are inside OSLA. Please refresh OSLA. Are you guys there? This is very important, because what happens is your tiny mistake can cause anxiety and stress, and it can affect your exam. Right, Komal? It can affect your exam, and the anxiety and the panicky that's created. Oh my God, you're out of the system suddenly. So it affects your performance. I don't want that any of the student has you should be so confident, and you should know what you're expecting in that OSLA performance, right? So please, when you're told to refresh your application, and this is the point where you need to refresh. You are not going to refresh from here, which is your Google Chrome. Got it? I'm going to repeat that again, Sadia. You have to refresh OSLA from the OSLA application, please. This is the symbol, and this is where it's going to be visible. I'll just show you now. Do not refresh on the top of the screen the Google Chrome, because that would make you move out of the OSLA where you had entered. Got it? Sadia, did you understand that, please? Yes, my dear? Got it? Now, this is the right button, as I've mentioned, which is going to be refreshing in case you just have less of the, candidate instructions are not visible. For example, if anything, suddenly the chaperone tells you, please refresh your OSLA. So you should know where you're going to refresh the OSLA. You should be very clear about the refreshing button, and please do not refresh the Google. It is a very important point to not miss that out. These are all the mistakes which students had been doing. We had been informed and out of the mentorship experience. When you enter into the OSLA, you will get maybe 2 days before, 1 week before, your username and your password in the OSLA. You will go to the Google Chrome, right? You will enter the OSLA application and they will give you username and password, and it will show tick, 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 all, and you're going to log in to the OSLA. This is the first page when your exam is starting. All right, the login page. From where would you get your username and password? College is going to email you your username and password. The second screen would come. Felix, Sadia, Raisa, Fozia, you're going to have your startup checks. What are the OSLA app? Nisha, Google Chrome. Write it down OSLA, you'll get it now. Everybody, you can just write on OSLA, you will get it now, just now. But you need a username and password to have the exam, Nisha. That would be given by college. Got it, Nisha? Okay. It is just on the Google Chrome, my dearest. Right? Okay. Now, this is, I can show you, right? This is, I had been on Google Chrome. Got it? So you just write OSLA here and you're going to get, but nothing, Nisha, nothing. It's just on the Google Chrome. But when you click and OSLA comes, that will say immediately, please enter your username and password. That would be given by college so that everybody has it and the whole exam is conducted. Your role player, your examiner, right? Do you get it, Nisha? So just to coordinate the exam, my dearest. All right? Okay. Now, once the login page is there, you will have your startup checks. In startup checks, there will be screens. So from this point onwards, guys, it is colorful because I've made it, I've sketched it. So all the reference and the credit that definitely goes to the college the way they explain. But this is just to tell you guys the sketching, that how does it look like. In your checking your setup, so the camera would be there, the microphone would be there, connection check would be there, the quality of the connectivity would be there. You can see your signals and you can understand that, you know, how it shows. I mean, the signals are full till here, right? Connection is appropriate, microphone is working. It will show when you'll speak, hello, hello, mic testing, the mic would be working and you're visible. So there are 4 checking in the beginning. I repeat, the camera, the microphone, the connection, and the quality of your internet connection. These are your startup checks. Now, when you have done your startup checks and all is good, you will get a click button that would say, please proceed. Very good, Nada. Then you're going to proceed. Absolutely. Nada is absolutely right. We have the startup check in RCPI, Royal College of Physicians and Obstetricians, Ireland. Also, we have it when we do the MRCPI. Well done, Nada. Yes. So then you're going to proceed. Click on proceed and then you are into the system. Am I clear so far? Your login, username, password. Then you're first checking up your system and setup. And then you click on proceed. And you are into the candidate registration room. Clear, everybody? Right? When you are in your candidate registration room, you enter saying that it is basically the camera is visible, right? And with the camera, when it is the visibility there, you can see the mic, it's mute or unmute on here. Your candidate number, your details are given there. The registration is in progress. You can see here, and the timer would be visible there. You will have certain symbols on the right-hand side here where you are going to have the description. You should know that what each symbol means. You would be visible in front and your chaperone is going to be there. You can see throughout that how much time is remaining when it comes to registration and how much time to the start of the exam is there, right? So you're visible in the camera and your registration is going on. This is pre-exam starting, right? Okay. There are certain things that you have to know throughout. Here on this side where you will be visible, there would be a timer running. So you can know that what is expected throughout the exam. Moreover, there is direct message tab, there's a direct refresh tab, and there's a log out button. Now I need attention from everyone out there, please. This is from where you can direct message and communicate. I am going to the toilet. I cannot see the candidate instruction. I have problem in listening to the role player. Do you guys get it? And you'll get a response from the chaperone. So the icon number 1, where the message picture is there, this is so clear. And you can communicate. And the second option is that if you have any concern, just raise your hand. Did you guys understand? This is the direct message. Did you guys get that, please, everyone? Please let me know. This is very important. Each and every mentee out there. Did you guys get it, right? It is so important that you have a clear understanding regarding this icon on the bottom on this side, which says the message. All right, from here you can write anything and your chaperone throughout from the start till the end is responding to you. You'll get a response immediately. Got it, Kamal, my love? Lolwa? Perfect, right. Then you have to understand that there is this icon. Now you guys are going to tell me this icon is for what? I have told you earlier. If chaperone says that, yes, exactly, this is communicating, very well done. If somebody says that you're not able to, you can't just have your candidate instruction, you can't see the role player, they would say refresh Ostler, please. Do not go on the top. This is refreshing Ostler. Here you're going to see that button. And this is very important that you don't click it till you get a signal. This is your logout. Everybody clear? This is your logout. Logout means that you are done. Right? Logout means that you're done. So you have to understand in this situation that logout would only be clicked till your exam is complete and you get the notification on the screen. Thank you very much. Your exam is complete. Even after 14 stations, if you do not get this notification, please do not log out. Why? Because you never know that you have a resit decided. Do you guys get it? Everybody clear? Log out would only be clicked. The last one would only be clicked when you're done. Right? Okay. Not at all, Raisa. We are going to practice on this right now. You see here that your registration is done. You are ready. I'm so grateful, my dearest. Thank you very much. This has been lots of effort. I mean, this drawing took me whole day, but I just wanted to give you an idea so that, you know, you're not blank on that day. I feel the students are very well prepared. It's just the anxiety of that what's going to happen. They lose the confidence. So what I want is that you guys have very clear understanding that, you know, what is expected there, Mary. So you don't have a problem, Mariam, there. All right. So you exactly know which button is needed. So the preparation is always there. I need confidence that you exactly know that where to click, when to click, and what is expected out of that. Right? Ameen, my dear. Thank you for your prayers. Now this Fadi, this candidate registration time, it's here. It's 1 minute, 23 seconds. Your registration is over. So what do you expect now? Now you expect to enter. Thank you, Shweta, my dear. I did understand from your words because I know that you guys are my responsibility and I do understand that how much pressure it had been for this decision. So I just wanted to ease that pressure, my dear. Now your first station has started. A very important thing at this point you guys need to remember. I have taught to you the communication skills. I have taught you the patient safety. You guys are super prepared. The best thing about Ostler is you can exactly see your schedule here. Mariam, pay attention here, my love. Afreen, everybody, Shweta, you guys have to see here that what is expected. The whole candidate schedule is coming on this side. This much will be started when? This much would be started when? Station number 1, station number 2, station number 3, right? What would be the timing starting? So you can organize yourself till 7, you can see, then you will have 12 minutes break. And then again, you'll start from 8 to 14. So everything is visible here, right? Okay, clear? You would be visible till here that your station is starting in 5 seconds. Your station is starting in 5 seconds. So now you're ready that now your 2 minutes of the candidate instructions will start. Now comes the game changer. Now comes the most important point. This would be your screen, guys. Here, unfortunately, the students who don't get the guidance, who don't know how to read, they lose the exam. So many times, I remember 2021 receiving a phone call saying, "Ma'am, I didn't see the ultrasound was there. Ma'am, I didn't see that her operation theater notes were there." You know why? You have to understand that now when you have reading time, this would be the screen. Where would you be? This would be your picture. You will move from here, from the center. Everybody please understand, the moment the candidate reading time for the instructions start, you will move here and throughout you will stay on this picture, on this side of the screen, please. And your candidate instructions would visible as a big screen here, and you tap at the bottom, there is a pencil here, you tap here, your notes visibility is only to you. You can write down here BMI. Don't forget blood group, VT assessment. Do you guys understand? All those points which we have in mind. You can write Anne. You can write, name. You can write all the details which you want to write. That would stay with you. You will click on this pencil. This is reading time, guys. This is reading time. This is your 2 minutes and 30 seconds for Osler reading. Are you guys there, everyone? Are you guys with me? Right? This is the reason that I'm talking to you guys now. We have more than 30, 35, few people, they have 40. We have these days to work on typing. But I don't want you to write on stories, right? Mariam, ma'am, we will type from laptop with their pen. No, you have to type on the keyboard, Mariam. You have to type on the keyboard. You will write in the keyboard BMI. You will write on the keyboard that, VTE, blood group, whatever you write on the writing pad the other way around, right? In the face-to-face exam, you are going to type and this would come up here as a text box, right? As this here would be the pencil. You will click on this pencil and it will initiate, the cursor will move and only you can see your notes, friends. Your notes are not visible to the role player, to the examiner, to you only, your notes are visible. Where would these notes go? I'll just tell you in a bit now. A very beautiful thing is in Osla. I will just tell you now. But first of all, it will start typing. You'll click on the pencil. The candidate instructions are there. And this page will appear when you click on the pencil, Mariam. And it will start. You can start typing there. Got it, please? Sajid, I will explain that to you, my dear. Now, certain times, students are not comfortable. Now, one thing I have to tell you, please, no matter, I don't want you to purchase or buy, but from your friends, from your family members, please take the biggest MacBook or the biggest laptop or the desktop. Bigger the screen is, better you perform in exams so that your candidate instructions are very big. I don't want small MacBooks. I don't want small laptop with tiny screens. I don't want iPads. Of course, they're not preferred. You need to have the big screens, big laptop. I can send you certain pictures. The biggest screen available. The backend team, you can tell the biggest screen available as per this, right? Why? Because if your screen is the maximum one for your laptops, for your MacBooks, definitely that is going to be a better vision because everything would be bigger. It's natural, right? As per your frame of your gadget. All right. Okay. Now, what happens is, as I told you earlier, that students, they say that ma'am, we couldn't see that there was an ultrasound. We couldn't see that there was operation theater notes, Shweta, right? So you need to be on a desktop, Shweta, because you have to put your chair, right? Yeah. Now, you have to understand that there's a cursor here up, there's a cursor here down. You need to know it today so that in exam you guys are very confident how to navigate. There's a cursor here, zoom in. There's a cursor here, zoom out. Make it smaller, make it bigger. On the top and on the bottom. What happens is that on the bottom of the candidate instruction, it is written 1/3. That means what? You've got 3 pages to see. So many students, they don't see it. And when you don't see it, you don't go to the 3rd page. So you have to go down, click, 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 Second, click, click, click. Third, click, click, click. Go back to 1. Click, click, click. Go back to 2. Did you guys understand? There are stations, guys, where it would be written here 1 by 5. That means you have operation theater notes, you've got history, you've got discharge letter, you've got an ultrasound, right? So you should know that there are 5 pages that you have to see. This is the most important thing I always say, and I don't want students to miss that out. Am I clear? When candidate instructions are there, immediately see the number of pages and please use the cursor to go down and go up. Is this point clear? Because this would be your situational awareness. And students, they miss out doing this. Am I clear, everybody? Am I understandable? I would be ringing in your ears like all part 2, part 3 exams. I will be telling you guys again and again, please remember these points. This is very important. This session is going to be on YouTube as well. So you can definitely listen to it again and again. But I want that these things are on your tips, with your reflexes, that you exactly know that what is expectation. All right. Now here your time would be there. The 2 minutes are there. You will write your notes. It will go on website. I will definitely do that, my dear Felix. Okay. Now, all the fast track students, all the mock exam students, definitely would going to post in your groups as well. Don't worry. All right. Now, when you tap, you put your notes there. Yes, absolutely, Mariam. I will do that, my dearest. So write some notes here, right? And you can write the notes after tapping here. Now, the best thing about the Ostler is that the timer is coming here, but whenever your last 1 minute is there, the timer comes in the center to tell you that now your last 5 seconds are there. 0, 2, tick, tick, 5, 4, 3, 2, 1. And the next screen comes. Immediately the examiner comes, the role player comes, and they're on your screen, and you start your station. Am I clear? No, it's not allowed, Lolwa. College clearly says no writing material because it's confidentiality and you have to respect. You can't take any notes out of anything. Not allowed. All right. Thank you very much, Safa, for being here. Hello, hello. Good to see you, my love. Must be sitting in the clinic, yeah? Thank you, my love, for taking and answering the questions. So the labor ward prioritization, you're going to take the notes on the screen only, Shweta. Just write your notes there. Now the timer would come and the screen would change. Now comes the screen. Here, you're going to have the role player on the bigger screen. If it's a layman examiner station, now the clinical examiner would come here. The layman examiner would come here. You are already here. As I told you earlier, throughout the exam, you would be here. Your connectivity would be shown here. You can see your signals throughout, that they are full, they are complete. And there would be an icon here where you can click on this and that shows brief. Immediately your candidate instructions would appear. If you want to keep it here, if you want to make them bigger, you are going to click to keep your candidate instructions on the screen. But if you're okay that it is not needed, you want role play to be bigger, maybe in the Breaking Bad news, you want your role play to be bigger, you can make them and you can exchange amongst this. You can always keep one as a bigger screen and you can exchange amongst this. Now, your notes are here. You can see your notes here. If you click on this means what? Maximize. Everybody please understand. This means what? Maximize. And these are same. Message to the chaperone. This is your refresh and this is your logout, which you're not going to see. All right. If you want your brief to come, immediately you're going to click on this and your candidate instructions would come. If you want to see anything throughout, it can stay on the screen throughout. Whatever you want to make it bigger, that would stay on this screen. The rest of them would be smaller. Now, I have written enough of things on my notes and I want my notes to be bigger. What would I do then? Nisha, brief is your candidate instruction. For example, immediately 2 minutes are over. Nisha, your 2 minutes are over and this slide, the candidate instructions are gone. Immediately the role player will come here, the clinical examiner here, the layman examiner here, your notes are here, whatever you have taken, you have written in 2 minutes, Nisha, so you can't see your candidate instruction. You will have an icon here, brief. You will click on that, your candidate instructions will appear. You want to make that bigger, you will put them here in the role player. Then role player will become smaller. Do you guys understand? Whichsoever thing stays here on the screen would stay bigger. But there are many students who say that, ma'am, we wanted to see the role player bigger, so candid instructions were not needed. For example, it's a breaking bad news, ovarian cancer. So you don't need to see the candid instructions again and again, right? So you'll just put the candid instructions smaller and the role player bigger so that you have that connectivity and empathy there, right? Now, I have written certain points and I want my notes to be bigger. I will click on this here on the bigger screen and it will go here on this big screen like notes. My notes will come here. It will become on the bigger screen here and the role player will switch to smaller. So there are so many stations where you want to see, if you click on this, that will move here and the role play will become smaller. Do you guys get it? For example, your notes in the station. In the OSLA, candidate instructions, especially for the labor ward prioritization, please keep them bigger. So keep it in front of you so that you can, take the rooms one by one, right? How many person in the room? All of you, it depends upon the station. If it's a layman examiner station, then role player, clinical examiner, layman examiner, and here is the candidate. If it's a structured discussion, it's only clinical examiner and only candidate. If it's a simulated patient task without layman, clinical examiner, role player, and candidate. Do you guys get it? Exactly. Just click on the arrow and that would come. You can shift amongst being bigger on coming on the big screen by clicking on the maximize arrow of each. Am I clear? I want generally, if the notes are too much for you, so keep your notes in front of you because they're visible to you only. The scenario will stay if you click on the brief. You have to click on the brief to make your candidate instructions visible, everybody. This is the main thing. If you understand this, guys, you are very safe and confident and you'll enjoy your 14 stations, The problem is that sometimes students are facing this for the first time. They don't know what to expect. And then more than brief is the candidate instruction. Yes, nada. And suddenly when something comes in front of them, they are like, okay, so all the practice they had been doing, the preparation they had been doing earlier, that goes in vain and they are panicked. So because of panicky, they lose the exam or they can't perform to their best of the capabilities because they don't understand how to, move around certain parts to give their best and show their best of the capabilities. Do you guys understand, everyone? Right? This is a layman examiner station because we have layman examiner, we have clinical examiner, right? Exactly, Nisha. Role player can always see you. No matter role player is here, no matter role player is smaller, no matter role player is bigger. It's about you that you want to make role player bigger or not. It's about you that you want to make notes bigger or not. It's about you that you want to make candidate instructions bigger. Whatever you want to make bigger will come on this screen. Am I clear? ASIA, not in all case. If it's one line of a candidate instruction, it doesn't make any difference. Then at times in the breaking bad news, I've seen students, they say that, ma'am, I've kept my role player bigger so that I understand the gestures, I understand the expressions more. Because in a smaller, you might get a little distracted, Do you want to understand that? You want to see the task? It is brief. Click on this, it will stay with you on the screen, my dear. Right? We have concern with only role play and brief and note, whatever we want to maximize. Exactly. But Mariam, in structured discussion, make your examiner bigger so that you understand the new questions are coming up, my love. Right? In structured discussion, you can make your examiner bigger. Sadia, brief is this. This is brief. This is what I have written to tell you what is this. This is brief. This is brief. This one. Okay? This one is brief, my dear. All right, Mariam, did you understand, my dear? In the structured discussion, you can make the examiner bigger so that you understand that, some question is coming up. Examiner is trying to say something, my dearest. You understand, right? Because you don't have a role player there. And if you want to keep the candidate instructions, if there are too long pages, you can definitely scroll up, scroll down from here, and you can see your candidate instructions very clearly. Got it? Now, 7 stations are done. You take a break of 12 minutes, you come back and you start from the 8th station again, right? So yes, so Rubab, but smaller. Role player will become here if you want to keep your candidate instructions bigger, my dearest. All the time, everybody would be visible. Nobody would be vanishing, but yes, they will get minimized or big, depending upon what you want to keep in the main screen, Rubab, my love. Got it? Yeah? So now, do not leave if they're saying verifying exam session. That means, see, station 1 done, 2 done, 3 done, 4 done, 5 done. Did you guys see? All of you? Right? Yeah. So this is candidate registration briefing. Candidate registration done. All of you please pay attention. Candidate briefing done. You can see yourself what's done, what is up to coming up. So you have a very clear idea that you know what is done for you. The system will say tick, 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 tick. You have done, your registration is done, your briefing is done, station 1 completed, station 2 completed, station 3 completed. You can see here very clearly that what's going on in your exam. And once you have completed, they say that please wait, verifying exam session. Do not log out. Do not leave at this stage. If they say stay there, please stay there if you have a reset station, right? But if they say it comes, thank you, the exam is now complete. You may now safely close the app. The moment you get this, yes, now you are going to click on this, which I was saying, please don't click in the middle of the exam. Am I clear? Did you guys understand? When your all stations are done, in the end, you are safe to leave the OSLA. You will stay throughout here as everybody. Please ensure until unless you get thank you, you may now safely close the app. You can just do the logout at that point. This was a very humble, tiny effort. All the credits to the college who have been explaining this. I just wanted to illustrate as closer to the OSLA by making all these drawings so you exactly know what is expected, but at least you have a fair idea about the OSLA now, about the tiny things which were disturbing you and you were not able to prepare for your exam since the last few days. I could understand the anxiety and stress in the study groups. I just want that you should be very clear. Can I request the backend team to make the students unmute if they have any question, please? Yes. Can I request that they can unmute? Yes, you have given. Can somebody check the mic, please?
Hello, ma'am.
Hello.
Yeah, hi. Thank you so much. Yes, thank you very much. You guys can unmute yourself. If any question, I am so grateful, Komal, and I miss you so much. Take very good care. Thank you very much. Yes. Yes,
Ma'am, how are you?
I'm good. Thank you very much, Mariam. How are you doing, my dearest? Long time.
Alhamdulillah. I have one question, ma'am.
My dearest, yeah.
Like you told that it will be displayed that how many stations we have done so far. So
Yeah.
which button to click and come to know that we had done how many stations so far?
So when you see here, the station number 1, 2, 3, 4, 5 would be there. So you know, you just come down and you can see scroll down like this, done, 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 done. So from here you can review all of them, my dear. So
Okay,
yourself,
so
for
there will
example,
be the button.
yeah, there will be a button and you'll scroll and it will be visible to you as well. Like 1 done. When you're on 2 undergoing, so 1 would be definitely tick. So you understand that. And after 7, when the break comes up on your screen, so that definitely means you're starting from the 8th one. Get it?
Ma'am,
And
my another
Hello, ma'am.
concern, like I told you before, that when we click the pencil, then we will be able to write from our keyboard.
Yeah, you will type from the keyboard. That's why, Mariam, I want you now onwards to practice on typing, you know, because this is how you, for example, there's certain things, it's an early pregnancy. You want to write blood group, I should not miss. So, you know, that keeps on your notes are in front of you on the screen. So you keep on seeing that throughout that, okay, I don't have to forget the blood group. I don't have to forget Jehovah's Witness. I don't have to forget BMI. Okay, these type of things you should be able, not big lines, guys, but at least reminders, pointers, you know. Right?
Hello, ma'am.
Hello,
Hello,
ma'am. The questions are done, my dear?
No.
Okay,
Hello,
thank you. One
ma'am.
by one, guys. I would prefer that you guys raise your hand so that I can take everybody one by one. Nada, yes, my dear. First of all, Nada raised hand. Yes, Nada.
Hello, doctor. Just I want to ask, shifting between the stations will be automatic, or we have to click to be shifted to the next station?
No, automatically when the time is up, the screen will go away and the next screen would come up. The 2 minutes reading time would come up.
Okay.
Okay.
And
When the
doctor,
timer
they
comes
will.
in the end, in the last 1 minute, the timer comes in the center that, you know, it's like 55, 54, 53, 54, 10, 9, 8, 7. So you understand that it's 9 and last 9 to 10 minutes of your station.
Okay. And doctor, regarding the mock exam will be the same?
We will try our best to be as close. The website team is going to guide you on that. They're working on that.
Okay, thank you so
Thank
much.
you very
Okay.
much. Shweta, please, you raised your hand. I would request all those who have done the query, please kindly put your hands down so that I understand who is there. Yes, Shweta, my dearest.
Ma'am, the first question is, do we expect now all the role players to be from UK itself? How does it work?
Now, that's a very difficult question, sweetie, because every time the availability matters. But as per the last Ostlers, last to last, yes, they were mixed. Not all, but yes, they were mixed all over the world.
Okay. Ma'am, the second thing is like in the labor ward now, since there is a little more to write, is it
Yeah.
your suggestion that we practice not writing much and just keeping everything in our head?
So now, because the last few years, as I've told you, we are practicing in the fast track as well, my dear. The way I'm making you practice, the way Safa have been guiding you guys, that please ask questions because we get too much of an information reaching out there. So I would prefer that not writing with a pen and a paper. It's better that you type if you want to have some questions in your mind and you keep on notes. But my preference would be that you keep the labor word bigger and you ask there and then because your information from the examiner would totally change your prioritization. So it's better that you ask and you retain that and you can do it side by side. Keep the labor word bigger on the big screen, my dearest, because there's a structured discussion. Only one more examiner would be in a smaller screen. So it's okay. That is better. For the labor word prioritization, do it there and then that's better.
Okay. Ma'am, the third thing is, by any chance, if we do this silly thing that we log out, what happens then?
You'll have to start from the registration again.
So that's like a full wastage of time, everything? Yeah.
Then the chaperone is there. Definitely that time, whatever is going on, they're going to, that is one of the point where the reset happens, of course. Yeah. So whatever
Okay.
station time is gone, so the examiner in the role play would be there and you won't be there because you logged out. So you're going to have it again.
And the time starts from where we left, right?
No, the station, for example, station number 5, you've logged out. So when you log in, all your registration and everything is done. So if, for example, station 6 is going on and or the station 7 is going on, so the 5 and 6 is going to be reset. Because that is what chaperone is observing, right? That your all stations are completed or not.
Okay, got it, ma'am.
Yeah.
Ma'am, the other thing is I couldn't really understand that thing. The smaller role play, when we are minimizing it, where does it go? It goes to the notes area or it goes
Exactly.
to
To the
the...
notes area. Whatever you make bigger, it gets exchanged. It goes up and the other goes down.
So we are still able to see his expression, right?
100%. Everything is visible. Everything is visible. It's just about the size. You know,
Okay,
that what you
thank you.
want to make maximize and what you want to keep smaller.
Sure, thank you.
Okay. Thank you very much. Thank you, Shweta. Fawzia Khan, my dear, your question. Fawzia, your
Hello,
question.
ma'am.
Hi, my
Yeah,
dear.
hello,
Yeah.
ma'am. Yeah,
Hello.
thank you so much, ma'am, for explaining everything.
My
But I
pleasure.
have a question regarding, like, do we need to keep our identity, like which identity we need to keep, like the passport and these things?
So the instructions are in front. You need to have your passport for the registration from the beginning, and that's it. So keep 2 IDs. I mean, to maximum for the registration to be on safer side. But I think so far the passport's been fine, right? Yeah, keeping one would be fine, which actually again the name which actually is with the college. So that's enough.
Okay, ma'am. Okay. And
Thank you
ma'am,
very much.
regarding like the brief you were telling, so we will click on the brief and
To
then
to
the
make the
role,
candidate instructions visible, and that stays with you.
yeah. And
Okay.
the role player will go down or he will be on the same
So
screen?
role player, if whatever you make maximize, the others will shift on the lower column. They will be visible. If you want your candidate instructions be
Okay, ma'am.
smaller,
Okay.
role player would be smaller,
Okay.
everything. But if you want to maximize it, keep it on the bigger screen. The others will be in the lower column like this.
And
Hello,
ma'am,
ma'am.
if we again want
Okay,
to
thank you,
smaller it,
ma'am. Thank
ma'am,
you.
One
if
by one,
we,
one by one, Fatima, please. Questions done? All
ma'am,
right.
I have question, ma'am.
Yes, my dear Fatima.
Ma'am, the screen which we are maximizing, if we want to again do a minimize and we want to maximize the other thing, we have the option for all the
You
screens.
have the arrow. You have the arrow. Just click on the arrow and it goes up.
Okay, ma'am.
Whatever you click on maximize will go there. The other will replace and come on the smaller screen.
Okay, ma'am. And ma'am, I can't able to find the Ostler app on the Google. I try to find
There's
it,
no
ma'am.
app. You just have to write Osler there. You'll get the application there. Message the website team. They'll help you with that. Okay.
Okay, ma'am.
Just message that the ma'am is saying, help me, please, or just write in the fast track. They're going to give
Hello,
you.
ma'am. Hello,
Hello,
my
my
dear friends.
Hi, Safa. How are you, my dearest? Yes, my love. Safa wants to
Thank
say something, guys. Yes, my dearest.
Yes, ma'am. So actually, this online exam is very good as well, ma'am. There are so
Yeah,
many
the
aspects
benefits.
to.
Yeah.
I myself had a, but only thing
Yeah.
is that we need to be tech friendly. Like instructions, sometimes we have to scroll down the get the last one. We just to see the first part alone. We think okay, that's all. But we have
True.
to scroll down because it happened. They will keep 3 to 4 pages and all. The
Absolutely.
scroll down is very important, ma'am. That everyone should understand that how to do this.
I made a special figure for that. That please see the number of pages, 1 by 2, 2 by 2, 3 by 2, 3 by 3.
Yeah.
So be knowing that how many are there. This should not be missed because then you're losing the information, situational awareness. You can't
Mm.
take the station further for the applied clinical knowledge. Right?
Yeah. Yes,
Yes,
ma'am.
my
Yes,
love.
ma'am. Yeah, and one
Um,
good thing is that there will be a timer. Timer will be there, so we know that how much time we have left, so we
Absolutely.
can finish the station accordingly, ma'am.
Absolutely. Absolutely. All right. We'll take the raised hands, please. Tazeen, you want to say something? Thank you,
Uh,
Safa. We'll answer the question side
Yeah,
by
ma'am.
side, my love. Yes, Tazeen.
yeah, Dr. Siddha, just wanted to ask that
Yes, ma'am.
we need to write to the college that if we want to continue or we want to withdraw the exam.
That's your choice. Yes, you can write in the email. I think they didn't give the option, but definitely you can have your personal communication, my dear. You can do that as per your
Yeah.
wish.
So if we want to continue, do we need to write them again or it will be
No, 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 no.
automatically understood?
All those who were in Abu Dhabi, all those who were in Lahore, all those who were in Riyadh, they have been given the confirmation. So if you don't want to continue, then you can do the communication as per your choice.
All right. Thank you.
Thank you very much. Yes, Lolva, my dear.
Yes, thank you, Dr. Sidra, first of all, for the effort. I want to ask if there is any requirements for the room that I sit in, because some of the exams that I have been doing in the online, they told me no books in the room, no cameras, the CCTV camera, and it has to be a locked room. No, there is a door. It has to be a small room. There is no mirror in front of me like this. There is instruction. So they will do that in this exam.
So the thing is that, of course, CCTV should not be working. That's something this is for all online exams. You should not be able to record. Of course, we need to respect the all the confidentiality with the college. The books should not be the reading material, but otherwise the tables, the chairs, the furniture, these things are there. It's okay. Students, they do that. Why it should be a quiet room? It's for your ease, not for, the college preference. It's for your ease. So you can send me the options and I can help you with that. Okay.
Okay. And one more thing, between each station, how many minutes between each of them?
Total 2.5 minutes, which includes reading plus shifting. That's it.
Oh, okay. So I
30.
can use the 2.5 minutes for reading time?
Yeah, that is your reading time. But generally, they say 30 seconds it takes for the, uploading and shifting because of the technical, that shifting gap. So 2 minutes minimum you have for reading. 30 seconds can be, it might get visible early. It might not get visible. It might take 30 seconds. So overall 2 minutes you have for reading.
Okay.
Yeah.
And one more thing, if I cut off, my internet went down, or I cannot see the role player or anything, they will repeat the station for me?
If anything is there where the examiner says that I'm not satisfied, the candidate was not audible, the role player was not visible, any technical error from any of them is there, it's examiner's decision, the chaperone is noticing that, they would put you in the reset, and in the end you won't get a signal of completion of exam. They will give you a signal that at this time you have a reset station. So you should be ready for that.
Okay. Thank you so much. Thank you.
Most welcome, my dear. See you in the study crew. Thank you. Isha.
Ma'am, the reset station will be the same or the different, ma'am?
They are both options, my dear. They have backup stations as well, and they have new stations as well. Okay, and they have the same. It depends upon that if you had been seeing. So because there's a time gap, right? So they don't want you to get prepared for that. So if you have done, so it might be a new. It totally depends on college decision, my dear.
Dr. Chandra?
Okay. Yeah, one by one, my dear. Yes, Sajira, you want to do early? Yes, Sajira.
It's okay, I will wait.
Yes. Okay, Nisha is there. Nisha did first, please. Nisha, you raised your hand, my dear.
Yes, ma'am. I just wanted to ask because anyway in the UAE that the internet is very good, but like we are not. It's with the Wi-Fi only. We are not connecting some wire or something to the laptop. And in these days, when everybody is online doing something in the like so many, so sometimes
I'll
it's
guide
getting slow. Sometimes I feel
No,
that after
I'll
this
guide you
discussion.
about that. I'll guide you on specific of Etisalat, and I'll tell you about that where they have the fiber optics. Okay, I'll tell you about that, and I'll send you
I
the.
think we have the same, ma'am. I don't know, but
But I don't know, fiber optic might not be there. I'll just tell you about that, and you can call them and you can tell them that, for example, 24 hours, 48 hours, I need this. So they will really help you in that. Okay.
oh,
Yeah,
I'll guide.
okay.
ma'am,
And
about this internet connectivity, if there is any connectivity problem from our side, sometimes they won't take it, ma'am. So it is very important. We should make sure that we don't have any internet issues at all. Only from role player side or from the examiner side, if there is any problem, and if the examiner suggested, yeah, she needs reset, then only they will give reset. So it is compulsory to make sure that your internet should be good, and it is better to connect directly with the Wi-Fi. Don't use that, wireless and all. Directly connect the wire with your laptop, and
Yeah.
please
Nisha, I
disconnect
will.
other devices and all from using that Wi-Fi. Only
Yeah.
for your laptop alone. And also,
Nisha,
you should have some backup support also for the current electricity and for this everything. We have to be very very much ready for that.
that's the main problem. That's the
Yeah,
main issue for
I will suggest
anxiety.
you to, no, don't be anxious about this. The place where you are, you've got multiple options. Just message now to the website support and they will give you a checklist. Okay. So just do that and they'll check your internet connectivity as well. Okay.
And
They'll
one
just.
more thing, ma'am, because our main connection, like for personally me, where my main connection is there, the router and everything is there, that's a living room. So usually we don't have doors in the living room.
They exactly would tell you the LAN and everything, message on the website support number, this second number, and all the sequence, the steps, and the day before yesterday, one of the students, they did all the speed check through their internet through having the desktop access. So they'll do that for you and they'll make you understand that, what type of that needle moving on the speed connection is there. They'll tell
Yeah, yeah, yeah.
just do
And
that.
do we need to use the headphones or it's okay if we
It's
communicate?
better for the connection. It depends upon you, but always keep your headphones on the side. If any mic problem on your gadget is there, always keep your headphones as a backup so that you can put in there and it increases and improves your focus.
And as I told you that if it is in the living room and it does not have a door, so do you suggest that should I move to a hotel or something like that to
No,
give the
no, nothing
exam?
like that. You just go in the room and make sure that your connectivity in the router is there. They will do it. Don't worry about that. Okay. We have time. And I know about for you, I'm confident you'll be able to manage. Just message the web support. They'll just help you now and they'll give you reassurance after checking the speed. Okay.
Yes, thank you. Thank you so much,
Thank
ma'am.
you very much. Fadi, yes, my dearest. I'm going one by one. Don't worry, please. Fadi, Yasmin, Felix, Nada, Milan, and Fauzi. I'm coming to you one by one. The hands are raised. Yes, Fadi, my dearest.
I have suggestion. Can we do one of the fast tracks by Osler?
I maybe FT12. Let's see. We can just do a little on the online for maybe, or maybe for all the students who are taking online, I'll put them in one presentation because now you guys are mixed. On-site and online are together in the fast track presenters, right?
And
So
also the mock exam can be done the same way?
yeah, we will do maximum to be as close. Already the website team is working on that, my dear.
And you told for the support group number.
Yeah, the second one, my dear, this one. Just message them and tell them that, this is my question regarding the connectivity. Anything is there, all the technical connectivities, they'll help you with that.
Okay, thank you so much.
You're
Thank you.
most welcome. And please do tell me that everything is solved. Okay, right? Yasmin, is it an old hand or it's a new one?
Yeah.
New one?
No, it's a new one, Dr.
Yes,
Sidra.
my dearest.
Hi,
How are
Dr.
you?
Sidra. Hi.
Thank
Alhamdulillah, how are you? Alhamdulillah, I'm
you.
good. Dr.
Yeah,
Sidra, just few, I feel like stupid questions, which I just said so that
no,
I'll
there is
confirm
no
it with
question in the world which is stupid. I always say the questions are always welcome. The answer can be stupid, by the way, but the questions are always welcome. Yes, my dear, tell me, please.
Yeah. So, Dr. Sidra, first question is like, you will guide us regarding the topics and what we have to do for the fast track and regarding for those.
Yes, I will definitely. Yeah. And I will be doing some talk articles as well, which are upcoming, doing for you guys in the fast track, which are because everybody in the world knows about, this is expected station, this is expected station. What we miss out is the new station. So I've already got the list of 2025 and 2026 talk articles. So we'll discuss about that and I'll give you in the fast track. Don't worry about that. Okay.
So the other thing, for example, in our after the history taking for the examination, we just tell her that can I examine you in the presence of Shukron? Should he say this line or no need?
No. Yeah, no online in online exam, there's no examination to be done.
Oh, we should not even mention this line.
Yeah. No, we should
Okay.
not.
And regarding the drawing of the diagram, so you said
No,
we should not.
nothing.
Okay.
College does not expect that in the online. No examination, no drawing, no props, nothing is expected.
Thank you, Sir.
Thank you very much. Felix, yes, my dearest.
Yes, that's right. Thank you so much. Very grateful. Yeah, can I use a background or you have to show your room? Can I use a background?
You should show your background. That is safety. That is transparency. So you should be able, they should be able to see.
See, okay, all right. And is there any particular software that is advisable to use, like Chrome or
Google Chrome?
Microsoft
No,
Google Chrome?
Yeah, they suggest Google Chrome, my dearest.
Okay, and then finally, so what size of screen would be ideal? 17 inches, 15 inches,
So
or
I
bigger?
would request the backend team to please put in the details for the screen sizes which are maximum available. So I don't want you to spend in so much of a payment in finances in terms of buying. But yes, you can get from your friends or family. And I would request if the backend team, are you there in the chat? RFA web support. Okay, great. So internet cafe is generally not recommended. Can you please answer them about the screens and all the technical answers? We will be great. Okay, thank you very much. So tell about the maximum screens they can have. So the biggest one they can take for the exam, please. Thank you. You'll get this answer, Felix. If anything else is there, let me know, my dearest. Okay. All right. Thank you very much. Sajida, your turn, please.
Yeah, thank you, Dr. Chidra. I wanted to ask, after finishing 7 sessions, we have a break, no? We have a gap.
12 minutes, yeah.
That time we will keep the screen in the same way, means we
You would stay there. You would stay there on this screen. You can move. You can go to the toilet. You can eat, but you have 12 minutes. So, after 10 minutes, before 2 minutes, you can come here back on this and then you can communicate again. So take 10 minutes break, but the screen would stay there. It will show on this, that break going on like this, candid briefing, station 1, station 2, station 3. So the break 12 minutes, then station number 8, you're going to start. Got it? Okay, thank you very much. Okay. So Shweta, you were talking about some TV thingy and LED, right? So this is what the team is saying. 32 inches, that is a table desktop that comes up. I have that, the bigger one for the gaming for the kids, So I do understand that at times they have that big screen for their LED screen and you can attach it there. So that is the biggest you guys can use, right? That is the LED screen with with your desktops you guys can have. Shweta, look into that. I can send you one example which is there in my upper rooms, So we'll send you that if you need. Okay, this is the biggest, which is like used as a LED screen, and that is with the desktops you can do your work. The website team also has that too for the working. Looking in camera is very important. Yes, absolutely. Please look into the technical advices the team is giving you, please, because all the technical in the website team, they're expert in this online thing, so they do know that. Mariam, ask the website team, they're in their chat, my dearest, all they can message as well. Eye contact is beautifully in this. Yeah, pose here. Okay, so Sajra has answered. Nada, your question, my dear. Coming to Milan. Yes, Nada, my dear, your question, please. Yeah.
Hi, ma'am. How are you?
Hello,
Thank
my dear.
you for your education.
Thank you. My pleasure. Yes, my dear.
Regarding mom, the station, if the patient already presented with pain, can I say, do you need painkiller or this will not be in the scenario as I mean in video consultation with the patient in at home?
Yeah, I do understand. So in that situation, if it's an emergency situation, you can say that because it's an online consultation, we would like to give you the painkiller and we would like to have you. So something like that you can say where you can mention it's an online consultation. We would like to have you and give you the painkiller. That would be better. You can't say that. No. Okay.
Okay, so as if the patient pulmonary embolism have pain, so I will tell her that we need to go to the emergency
exactly, yes, to have the painkiller and further evaluation in emergency.
Okay.
Hello, ma'am.
Very much. Yes, my dearest.
Hello,
Please,
ma'am.
Milind.
Yeah, regarding the eye-to-eye contact, actually, most of the time we have to look at the camera. Okay, we should not look at the role player. If we look at the role player in the camera, it will be seen like you are looking down.
Correct. Especially when the role player is here, guys. Especially if the role player is here on the screen and you're looking at the role player. See, look at me, guys. If I'm looking in the camera, now I'm looking at you guys, right? If I'm looking in the camera, see, it seems as I am doing an eye contact. And now I'm looking here. Can you guys see me? Now I'm looking here. How do you guys see me that I am looking down? Do you guys understand, all of you?
Yeah, this is very
Again,
important, ma'am. So
now I'm
you
looking
have
in
to
the
look at
camera.
the camera only, not at the role
Yeah.
player like on-site exam.
Absolutely. So looking at the camera now, that means that I'm looking to the role player, but now looking at the role player, so that means that I'm looking down. So make sure that you look in your camera. Okay. Yes, Milind, sorry, you were asking some question.
Hello, ma'am.
Yes,
Yeah,
my
so, ma'am, so if you're looking at our notes also, we'll be looking down, right?
So if your notes are somewhere here, bigger, so then you are very close. But if your notes are here, then yes, it would seem that you're looking down. But 1 or 2
So if
seconds is okay, but throughout the station, it shouldn't be like that.
So if you're switching the screens, the notes, the screen, all that will require us to look elsewhere from the camera, right? So,
Milind, I don't think that you'll do in 10 minutes again and again.
okay.
My suggestion is prepare yourself now that if it's a labor board prioritization, your standard instructions would be bigger. You don't need to see the examiner much. And if you're having an SPT, if it's a breaking bad news, keep the role play bigger throughout. So I feel that now we should be ready that what are we going to do? This is a preparation now, sweetie, not at that moment. What do you say? Right?
Yeah, that's right. So, ma'am, so now our practice should be with the screen.
Exactly. With the screen and with an eye contact and knowing that, okay, what would be now you should imagine yourself that, okay, I'm going to keep it this way. Right?
Okay. Ma'am, and can you repeat what we say if we have a role like this post surgical?
We would like to have you in the emergency, accident and emergency, to give you the painkiller as you're feeling unwell.
Yeah,
Okay.
ma'am. Another thing is as well that in the online exam, mostly these type of stations, no, ma'am, they didn't give
As I
post-op
told you,
complications.
Milind, as per the college, they make the stations in a way that they are suitable to online consultation. They take the exam that it's an online consultation.
So, ma'am, does that mean we won't be getting the stations where the patient is in ICU and we have to do
Generally,
postpartum
up till
hemorrhage
now, if you
briefing?
see the Oslo exams, what he'll do is I'll mark the Oslo exams for you guys. So when you'll see the
All
type
right,
of the
that would be
14
really
stations,
helpful, ma'am. Thank
exactly.
you.
Safa, we'll take out the Oslo ones, okay? So if it is that, you'll understand that,
Yeah.
how the things are, and you'll see that, okay,
Even
no
the
problem.
mannequin stations, they won't
Mannequin
keep.
station
Even
won't.
there was a breech station, teaching
But
station,
mode of
but
birth.
it was about teaching
Yeah.
the methods, like what are the delivery methods, like ECV, then vaginal breech delivery,
Cesarean
cesarean section.
section or
Like
normal
it was
maternity
like that
options.
only.
We need to, of course, respect the entire curriculum has to be prepared, but it is just being smart that we won't have any hands-on. We won't have to do the loft sets or the penals and everything. I expect you to learn that, okay, ECV versus breech vaginal delivery versus breech cesarean section. And the verbal part, but doing the face presentation and all pre-eclampsia teaching, or for that matter, bullying, or for that matter, teaching with the PowerPoint presentations, these are most important. We can't say anything. Of course, the college is going to give a very balanced exam, I'm sure, that to assess and to have a very fair assessment. But these topics are important, which are more of the verbal topics, please.
Okay, ma'am, one last question. Suppose there is a net issue, and so when will we know we'll have a reset? At the end, or?
Yeah, in the end. As I told you, that now this is visible, that your exam is complete. And if it's not visible, if it says that verifying, in the end, the chaperone would come and inform you that at this time, after 20 minutes, 30 minutes, you have a reset.
Okay, so if a station doesn't work out, they'll just shift to the next station.
So as Safa, because she has a practical experience, I've never taken Osler, guys. My mentees have taken. She has taken Osler as well. And many of the mentees since 2020 I've coached who have taken Oslers. They always say that sometimes they say that, ma'am, 3 minutes the role play wasn't visible, but the examiner was confident, said, no, I have assessed. So, no need to do reset. It's total examiner's, it's total examiner's decision. So at times examiners are comfortable in your 7 minutes of speaking as well. The role play was not there, but you were going on with the station. Candidate instructions were not there, but you were going on with the station. It is their decision if they want to take a reset. It's not your decision that you're not satisfied. If they are not satisfied, they would do the reset. But if they are satisfied, they might not do the reset. Okay?
Okay, got it, ma'am. So we won't know, we'll know at the end.
In the end, you will know that you have a reset, or they would say, thank you, the exam is done.
Okay, ma'am. Okay, got it. Thank you, ma'am.
Most welcome, my
Ma'am,
dearest
if
Nisha.
domestic violence, if the station of domestic violence, the role player with the black eye or bruised eye, is it
That can
possible?
come. Yeah, that can come, Mary. Yeah, that can come because it's visible, right? This is a verbal station. And depression, anxiety, the bipolar illness, psychosis, domestic violence, sexual assault, all these stations definitely can come. Yeah. Okay. Nisha, your hand is raised, my dear. Yes, my love. Nisha, is it the older one?
No,
Nisha, my love?
ma'am, I wanted to ask, like, and the
Yes.
examiners, like now, what we were thinking that, okay, it's Abu Dhabi, so the
I know.
examiners will be not the biased one, and
I
those
know.
problem we will not face. Is it like now
That
it?
this is something which nobody can answer, to be honest, because it's totally college decision. But as I started the session by saying one thing, that something is that what we plan and something is what the Almighty plans. So I think we should always bow in front of what He plans. So hoping for the best, my dear. Let's fight back. As I told you, nothing has 100% advantages and nothing has 100% disadvantages. It's just that whatever situation we have to do our best, right? Yeah.
Yes.
Okay.
Yes.
Shweta, yes, my dear. Shweta, you have
Ma'am,
to
my
bring-
question is,
Yes, my
are the offline and online stations the same since we are happening it at the same time?
Now, the thing is that last time when we had OSLA, I'm talking about the COVID, everything was OSLA. We had 5 exams. I coached the batches 2020. We didn't have any exam. 2021, we had 5 exams because lots of UK trainees, there was a backlog and we needed all the ST5s to have their progression. So it was all OSLA. So all year it was Osler, but now the same day Osler and on-site is also there. One is for Riyadh, and then we have in India, and then we have in UK on-site, and then it's in Abu Dhabi. We have in Pakistan online, but we have got the UK on-site. So one day, one exam is there. How college is going to do that? Definitely, that is going to be a balance, and I'm sure that it would be the best of the fair plan, which they would decide for the students. They do understand compassion is there. Definitely, it is a difficult situation. When you guys booked, you didn't
But
think that
most of the time, it will be the same stations for both
they won't
online
change.
and on
Same
site.
day, same day, they don't change, guys. Same day, all over the world, there's one station. And the timings would be similar. The timings when it will be started there would not be any communication and a very fair a plan is there. You don't know that, every single time, according to the UK time, the exam would start all over the world. Okay.
Yeah.
Ma'am, what happened last time when Pakistan went online? Like they
So
did
the
not have
problem
any
was,
teaching
no, the problem
stations.
was it was quite different to this time. When that happened, it was very, very close. It was 4 to 5 days before the
But
problem
that
started.
time it was only for Pakistan. It was in the August. There
So
were
what
no
happened?
other exam at
So
all throughout the
what
world.
happened was that exam was not, they did not have the planning time. It was very close that the geopolitical situation was worsened. So it was very close to the exam, 7 days before exam, then it got postponed because the situation arose just at that moment. So they had to postpone and make a special exam in August, and they were given a chance that you want to shift to November or you want to take August online. So it was only one odd situation. But now the situation had been going on earlier, so they had time to plan and organize the exam. Therefore, it has been taken, decision is taken well in time, right? So there was a
Okay.
separate exam. It was taken for only those candidates, and there was a separate exam conducted, a different exam conducted, nowhere else, only those students who were shifted from Pakistan separately. That's it. Yeah.
If the
Ma'am, how
situation
would you
is good
rate the
here, they
pass
did not.
percentage
It's a very
in
difficult question
Oslo
once
versus,
again.
I know it's a tough question,
No,
but
it
what is
is
your
a tough question,
experience?
and there's no fixed answer to that, Shweta. There's no fixed answer to that. It totally depends upon, I would say one thing, that we have to prepare ourselves so best. I mean, one-to-one stations are going on. You guys are in salvations. You guys are in intense practice. You guys are so wonderfully doing in the fast track. So many students all over the world. The only suggestion is give your best. Now you exactly know what is the expectation in exam. Try to train yourself according to that. Right? So once you start
Okay.
training about this, you guys would be perfect. Now you know that what is expected out of the exam, isn't it? Right?
Yeah. Right.
Okay. Thank you,
Okay.
A. Yeah. So A have been asking the question. A, from the Mind Mirror and all my Mind Mirror students, the dress code is the same. So you won't be visible from down. So you can wear some comfortable trousers, but yes, wear your blazers or wear some collar shirts and make yourself comfortable in that, right? There are different platforms. For example, Osla is one of them, and don't know which platform they use this time. Generally, they use the Osla, but all the platforms, they have got the same pattern, my dear. Okay, so last time also, the Myanmar exam in May was taken on Osla. Right? Okay. Yes, white shirt is okay. Yes, that's okay, my dear. You can send me the picture. Send me the picture. You shouldn't have some floral patterns on this. The lines are okay. Stripes are okay. All right. Okay. Thank you so much. Thank you. Any further questions, please? Thank you very much. This was just to relieve some anxiety. That was just to make you guys comfortable. At the end of the day, if it's written for you that you're passing the exam, 100% this would take you to that. Thank you very much for being here, for all those messages all around the globe, for help, for support, and for having faith in RFA. We are so grateful for your love. At the end of the day, it's a burden on our shoulders to make you successful. We will give our 100%. We'll work hard day and night. Since 2018, I've seen students working hard, making their best of the efforts. At the end, the only thing is that just see yourself that you're better than you yesterday. No comparison with anyone. Think about the best, have positivity, think about saying, I can do it, and you would see that you'll start doing it. And today, if you guys would see, oh my God, I'll have the internet problem. Oh my God, I would not be successful. Oh my God, why this has happened? I don't know. I'll be able to understand the role play, the difficulties would happen. Think positive, perform positive, work hard, and you would see the change. And with the help of the Almighty, you all would shine with lots of bright colors. May the Almighty be with you guys. May this decision turn out to be a miracle for you and all the success be yours. Thank you very much. Believe in yourself. Lots and lots of love. Best of luck from the entire team of RFA Tutors. See you guys in the study groups with lots of prayers. Thank you very much. If any further questions are there, for the technical assistance, for the curriculum assistance, we are here. Thank you very much. Bye-bye, everybody. Take good care. Recording would be uploaded. Thank you. Bye-bye. Take care.